Good afternoon from the Speaker Network newsroom. Victoria's Premier Dan Andrews is just about ready to step up to the podium for his press conference, so let's go there now.
We have 6,289 cases of coronavirus in Victoria. That's 374 new cases. 62 connected to known and contained outbreaks, 312 that are under investigation. There are 3,078 active cases. I'm sorry to have to inform you of 3 further deaths, bringing the total number of fatalities due to this virus to 42. A woman in her 100s, a woman in her 90s and a woman in her 80s have all passed away, and we send our best wishes and condolences to their families. This will be a particularly difficult and challenging time for them. There are 174 Victorians in hospital, 36 of those are receiving intensive care. On testing, we have now done 1,361,238 tests since January 1. Our testing rate per 100,000 is now exceeded 20,000 per 100,000. And yesterday we completed some 29,464 tests, so just under 30,000 tests yesterday. Again, as I always do, because it's critically important, can I thank each and every one of those almost 30,000 Victorians who got tested. That gives us the information we need to trace, to track, and to isolate and quarantine anyone who is a close contact or indeed a positive case. It's essential that we continue to see people come forward and get tested with even the mildest of symptoms. We've got more than 160 test sites across the state. I want to give a shout out to our laboratory technicians, to the enormous team of people who are taking those tests, that is, taking the samples, as well as, of course, a big thank you to all of those who continue to present and come forward in what is a fairly simple thing to do, but it makes a massive difference, a profound contribution to our fight against this enemy. In broader terms, obviously, tomorrow night we move to mandatory mask wearing. I want to congratulate Melburnians for having taken up the call to wear masks. Coming in this morning, I think 8 or 9 out of the 10 people I saw were wearing a mask. That's a fantastic effort. Again, a small contribution. I remind everyone it's not just a mask of surgical grade. It can be a face covering as well. Any protection is better than none, and it does make a real difference. But it is heartening to see so many people listening to those messages, changing their normal habits, and embedding mask and face covering wearing as part of just the normal daily routine. It's a small thing, but again, a bit like coming forward and getting tested, it makes a significant contribution given the amount of virus we have out in the Victorian community and our absolute determination as part of this 6-week strategy to bring stability to those numbers and to drive them down. It's always challenging to analyse any one day's results. You'd like to see numbers coming down. At the end of the day, though, we're not seeing the doubling and doubling again. So what that says to me, and I'm sure the Chief Health Officer can speak to this in more detail, is that the sorts of measures we've put in place are having a direct impact. But even with stay-at-home orders and a very high degree of compliance, even with mask wearing that is already occurring across the community but will be a mandatory feature of our daily lives from midnight Wednesday, we still have to follow all of those rules. We still have to make sure that we're washing our hands regularly. We're observing that cough etiquette. If we get a test result, or if we're waiting for a test result, or if we're the close contact of someone who's waiting for a test result or has a test result that is positive, we need to moderate the way we move around the community. No one can simply pretend that it's okay to go to regional Victoria, for instance, while you're waiting for a test result. Whether you had a test result coming or not, there's no need to be going to the far east of the state, for instance. That does no one any good at all. Again, can I thank all of those Victorians who are doing the right thing? They're making sacrifices large and small. I'm very grateful. We are all very grateful for that work, that absolute commitment to seeing this through and getting beyond this second wave. But there are still a small number of Victorians who are not taking this seriously. and are not following those rules. And the number of infringements, the number of penalties that have been issued by Victoria Police tells me two things, and should tell all Victorians two things. There are still some people who are not doing the right thing. That's the first point. And the second point is that Victoria Police are out there and they're not mucking about. They will fine you, and not only is it not particularly smart to be breaking the rules, flouting the rules, ignoring the rules, it's also just not the right thing to do. Each of us have a stake in this. Each of us will benefit from this strategy working. Again, I'm very, very grateful to those who are signed up to it, who are making sacrifices large and small and living a very different life today than has ever been the case. But to those who aren't part of that, you really are putting everything at risk. And I'd ask you, please change the way that you're behaving. Please acknowledge that everybody, your family, every single community across our state has a stake in this, and the stakes are very high. Very, very high, as we see with another 3 Victorians who have lost their life overnight. Beyond that, the mask issue, I just again want to say how pleased I am to see so many people already wearing masks before it becomes compulsory, and I'm very confident that there'll be a very high take-up, very high change. Lots and lots of people will change the way that they live their lives, and masks will simply become part of the daily routine. Again, I don't want to see even one fine issued for someone who should be wearing a mask and is not wearing a mask. Police will use common sense, of course, but at the same time, the rule is there for a reason. The Public Health and Wellbeing Act is there for a reason. No one enjoys having to impose mandatory mask wearing or face covering wearing, but when the health advice is so clear that we're in a different stage now than we've ever been, and to bring this second wave, both stability and then driving those numbers down when this is deemed to be an appropriate, proportionate and a meaningful thing to do, an impactful thing to do, then no one has any excuse, other than those common sense grounds, an underlying medical condition, for instance. People should do this. It's a bit disappointing to see a bit of commentary around the place about an act of civil disobedience. People may not wear these masks. That doesn't make any sense. Nurses and doctors who might well finish up treating you, they wear masks. So let's thank them for their commitment by wearing a mask as we get around, out and about for the 4 lawful reasons, only when we need to be out. The best way to thank them is to not finish up one of their patients, putting them at risk, putting enormous pressure on our public hospital system and our private hospital system as well. These are pretty simple things. I'm deeply grateful to all of those who've taken it up already, but I just to remind people that Victoria Police will be out there and they will do what has to be done, and that is enforce the rules and make sure that anybody who thinks that their choices are somehow more important, their preferences are somehow more important than the health and well-being of every single other Victorian, well then they will receive a fine. I do hope that isn't the case. I really do hope that people embrace this because they see it as being grounded in the best of medical advice and achieving the outcome that we all want to achieve. Stability and then a reduction in these numbers at the end of this second wave and moving back into a situation where we can get to that COVID normal and not have the sort of restrictions in place that have been necessary because of the amount of community transmission. I might now ask Jenny just to add to my comments, and then Brett can take us through any other issues. There'll be a release at 1:30, as there always is. Just before I do that though, can I know the Prime Minister's making some announcements, but from reporting and from some communication that I've had with him this morning, I have always said that JobKeeper, JobSeeker, these arrangements are critically important to putting a floor underneath some of the really significant economic challenges that we face. It's very pleasing to see those arrangements, albeit with some changes. They're going to be a feature of public policy. They're going to be a feature of our national response to this global pandemic for many months to come. Hardship, the commitment to me was always that hardship would drive the Commonwealth Government's response, and it seems from that reporting, I'll let the Prime Minister obviously make his own detailed announcements, but it would seem that he's been true to his word, and hardship will obviously continue to drive that. So wherever there is greatest hardship, there'll be the greatest degree of support, and I think that is a really important principle, and in practical terms it'll make a big difference to people knowing that support is going to be there, not till September, but indeed quite some time after that. We've had 2 very significant packages of business support. I can't rule out a third. I won't rule out a third, and I certainly would forecast that our budget to be delivered later on in the year will include both stimulus, as large and small, as well as strong support for those industries, those sectors that have been hit hardest by this virus. I now might ask Jenny just to add to my comments, and then Brett can say a few things, and then of course we're happy to take any questions you have.
Thank you, Premier, and good morning. I too want to join the Premier in thanking Melburnians in particular who have embraced the need to wear a mask, and I thank them for that, and we'll be providing a lot of information about the practicalities of this. There'll be a very strong communications campaign in coming days explaining to people the circumstances in which they need to wear a mask and the situations where they may not need to wear a mask, particularly around exercise and medical conditions. We're just working through the details now of providing masks for vulnerable people. We'll have more to say that in coming days, but we will be looking to work very closely with our primary health networks, with GPs and others to make sure the most vulnerable in our community can get access to a mask as well. Just in terms of our continued efforts to find cases and to test and trace and isolate cases, of course, that has always been our fundamental strategy to how we respond to this pandemic. We continue to roll out new testing locations across Victoria just about every day. I just want to remind Victorians that all of the details of those testing locations are available with a locality map on the Department of Health and Human Services website. We are aiming to provide a testing location within 10 kilometres of everyone's home in Melbourne, and you will continue to see more testing locations, whether they're drive-through testing sites or testing through a GP clinic or a public health service available in your community. And I want to remind Victorians that it is really important that people do go and get tested even if they have mild symptoms. We have had a number of outbreaks now, particularly in aged care homes and in workplaces where people have presented whilst they have been infectious and in some cases where they've had very mild symptoms. So it's important that people do take that opportunity to get tested. And as we have explained, we have made available a $1,500 hardship payment so that no one needs to make that difficult decision between putting food on the table and getting tested and staying home and recovering, keeping your family and keeping your community and work colleagues safe. Finally, just in terms of our contact tracing abilities, we have been expanding our capacity to more contact tracing. That team is now looking to be more than 2,000 strong, and we're very grateful for the support that we've had from the ADF and interstate colleagues, but we have been standing up additional ongoing resources of our own here in Victoria, and I'm very grateful for those new members of the contact tracing team who have joined us, both at senior levels and also those doing the foot soldiers on the ground, doing that important disease contact work. Can I just say in terms of the numbers today, that I know that all Victorians are, I guess, on an emotional roller coaster as they look at the numbers every day, and I just want people to be reassured that whilst the numbers might have been going up and down in recent days, that we are making some progress. In some LGAs, the numbers are coming down, clearly as a result of concerted efforts of people in those communities, but we still have very high levels of cases and community transmission in some parts of Melbourne, particularly in the western and northern suburbs of Melbourne, and we have seen a lot of cases across metropolitan Melbourne, and concerningly also in some regional communities as well. So there is no reason for Melburnians to be travelling to regional communities for any reason other than work, and it is important that people abide by the restrictions that we have in place so that we can keep our regional communities safe. At the moment, we have had significant outbreaks in a number of aged care homes. We're working through now the principal agreement that we have reached with that aged care sector to address these issues. I'm grateful for those aged care providers who have already taken significant action to limit the the movement of their staff across different aged care facilities. We know that this has been a risk factor, and we continue to see significant numbers of new cases in a number of nursing homes in Melbourne, and this is, of course, the most vulnerable people in our community. So we ask for the community's understanding, as these facilities, of course, have gone into lockdown. That means that they cannot receive any visitors, and we ask for families' understanding that that is necessary in order to keep those family members safe. And we will continue to work with the Commonwealth and the aged care sector to address these issues. But that has been driving some of the fatalities that we have seen, including one of the deaths that we have seen today. And I want to conclude by expressing my condolences to the families of the 3 women who have sadly lost their lives today. We continue to see increasing hospitalisation and increasing deaths in our community as a result of the increasing case numbers, and we can all do our bit to keep our loved ones and to keep our communities safe if we wear a mask, stay home as much as is possible, follow the rules, and most importantly, get tested and stay home and recover if you have any symptoms of coronavirus. Thank you, Premier. And Brett.
Thank you, Minister. Yeah, certainly we're seeing a roller coaster of numbers, and I think to a degree our anxieties do rise and fall as the numbers do. But there has been some levelling in the last 4 or 5 days. I know the day-to-day changes can be substantial, but the modelling of a couple of weeks ago, if we had been on an exponential curve, which is what happens with coronavirus, we would have been at thousands of cases at this point in time, and we're not. We're at 374. I'm not satisfied with that, but it's much better than 3,000. On the issue of masks, yeah, I just want to reiterate they are a significant additional measure that we can take. There is a small impost, of course, but masks are to coronavirus a bit like speed limits are to our road toll. They protect you, they protect those around you. I don't know that there are many who would argue that we shouldn't have speed limits on the roads because of the importance in protecting everyone in that setting. I think it really is the same for masks. It's a small sacrifice that we make. It's a small constraint on our liberties, if you like, but it's a really important one because there is no greater loss of liberty than the loss of your life. And so I think it's really important to bear that in mind as we look to protect ourselves and those around us and our loved ones. There have been challenging settings that continue to drive the numbers each day. I think the new community cases are actually less and less as we've got those restrictions that apply to household visiting and gatherings outside. But we know that the 4 reasons to leave home for those essential requirements are still opportunities for transmission, and that's the other reason why masks are really important in the workplace, as you go out to get essential services and goods, as you go out to buy food. So we're really looking at how to manage transmission in all of those settings and to try and drive the numbers down and drive the transmission down across the board. We have seen some stabilisation in some postcodes, especially the postcodes where there have been restrictions for a longer period of time. I think that's encouraging. There are other postcodes where the restrictions for stage 3 have been in place for almost 2 weeks, but that's not as long as for some of the other postcodes that are stabilising. So I'm still hopeful that we can see some levelling off and decrease in numbers in those areas. We've also seen a decrease in new cases in towers across Melbourne. Again, that's a measure of the community stepping up for testing, doing the right thing in terms of isolation and quarantine, and all of the service responses to try and support that as much as possible. So there's a mixed bag of good and bad news with postcodes and with different settings in Victoria. But I do have some hope that masks as a kind of universal element that we can apply here will be a really significant difference in the transmission risk.
Good. I can take any questions you have.
Brian, tomorrow is 14 days into that lockdown.
Yes.
What's your plan if numbers, so those numbers start to significantly decrease?
Well, tomorrow does mark the first 2-week period of a 6-week lockdown. I think there's always, I'll just remind you of a couple of points that we've made consistently, that things would need to get worse before they got better. Then there would need to be a period of relative stability. And then until you achieve that, any reduction wouldn't be meaningful. It could be a day, it could be 2 days even, where we had numbers fall, but they're only to spike up again. So it's too early for us to be talking about next steps. It's too early for us to be, I think, trying to be definitive about what the third week and the fourth week look like. This is very fast moving, but at the same time, a day in this pandemic is very much like a month. So we will continue to be guided by the data. We'll continue to be guided by the very best of expert medical advice. The other challenge with this, of course, is that there is that lag where things you do today, you won't necessarily see the full benefits of that for a couple of weeks. Clearly, the point that the Chief Health Officer has just made, and I'll make it again myself, if we had not put in place the restrictions that are just about to be 2 weeks old, then we would not be standing here reporting 275 or 374 as it is today cases. We'd be adding a zero to that number, and that's when it's really got right well and truly away from you, and the hospitalisation numbers won't be in the hundreds, they'll indeed be in the thousands. So by working together and with a very high degree of compliance, and again I thank those who are making sacrifices large and small, we're in a position where we're not seeing that absolutely exponential growth doubling and then doubling again every couple of days. That's not a small achievement, that's quite a significant achievement in the first 2 weeks. But of course we have to see these numbers better than what they are now. We have to see that stability maintained, and then we need to start driving them down. Ultimately we can't answer questions about what the next week or 2 weeks might look like. We've got to go day by day, case by case, positive test by positive test, track and trace, isolate people, and continue to encourage every single Victorian who has a stake in this. Everyone does. No family will be untouched by this if we can't bring this second wave absolutely under control, a sense of stability, and then drive those numbers down. So that's what we'll keep doing, keep on calling upon Victorians to abide by the rules, do the right thing, and that's how we'll get past this.
Premier, Colac is deeply worried about their outbreak there in their abattoir. The local mayor is calling for a 2-week lockdown just around that area to try to get it under control. Is that something you're in discussions with, or is it off the table?
I wouldn't say that. I think the key point here is to isolate any and all people who are close contacts, and just for the purposes of the record, there has been advice provided to that facility. It is closed. There's been widespread testing, and everybody in that facility has been asked to consider themselves a close contact and to isolate. And we have no reason to believe that people aren't doing that. So we're very grateful to both the owner of the business and all of their staff. That is a significant challenge, but I don't think we're at a point yet where we'd move to a whole of local government area or a whole of township public health measure to try and deal with that. I think that provided people follow the advice that they've been given, then we can we can limit the spread of the virus there. Having said that, though, these things can change, and we'll be monitoring that daily based on the numbers and based on the advice that Brett provides to me. But we don't have any advice for a different set of rules for that particular community. I do again stress, though, that might change, and I'm grateful for the constructive role in which the local mayor. The constructive way in which the local mayor is engaging with us on that.
Is that because there's no community transmission that it is at the moment?
Well, this is the thing. You can have many hundreds of cases on any given day, but if you've got a sense and you have some certainty about how each of those people got the virus, if you've done that coronavirus detective work, as we often say, and you can track it back and have a sense where the chain of transmission began, then you can control that. It's those genuine community transmission cases where you just can't work out how it is the person got it, that they're the ones that are really, really challenging. Pleasingly, those numbers are coming down in a number of areas. Those numbers are lower today in terms of new community transmissions, in that with the real mystery cases, there are less of those than we've had on other days. So we're bringing certainly stability to that, and we might even be, in a broader sense, driving those numbers down. So they're all, no positive case is good news. But positive cases where you can trace back and have some certainty about how the person got it, they're obviously much more easily dealt with. Not easy, but more easily dealt with.
You did reference in your opening that East Gippsland case. There's obviously some businesses which close down of their own choice, and a lot of people have said that they haven't been contacted by authorities, they don't really know what to do in that circumstance. So are you sending contact tracers down there? What's the plan?
That'll be contact traced like every other case is, and best endeavours will be made after going through the interview, a very lengthy interview with the person involved, trying to work out where they went, and then work, in a really painstaking way, work through one by one all the different settings, all the different people that might have been part of that. If there's a chain, then you've got to look at each and every link within that chain. That does take some time.
Was she given permission to go there?
Sorry?
Was she given permission to go there?
I'm not aware of the individual circumstances of that, but I'm happy to come back to you. The key point here is that if you, not speaking specifically about this case, because we may need further details, but if you are waiting for a result of a test, then without there having to be any sense of compulsion, it shouldn't get to that. You should do what is the most appropriate thing, and that is to stay at home and wait until you get the result. There'll always be extraordinary circumstances. There'll always be, different issues at play. It's a big, diverse, highly variable community. Lots of different people have lots of different roles to play. But ultimately, the role that we've all got to play first and foremost is to do everything we can to limit the spread of this virus. And if you're waiting for a test result, or if you've got a positive test result, if you're a close contact, then you have to follow those rules. They're pretty simple. You've got to stay at home. If you need support, as Jenny indicated, there's a $1,500 no questions asked hardship payment. If complying with those public health rules would mean you were out of pocket because you didn't have access to sick leave or you were a casual or things of that nature, then there is that direct support. And we are pleased to provide that support because we don't want anyone having to make that choice between supporting their family and working to protect every other family. That's a wicked position to find yourself in, and that's why we've got that fund.
Just on that case, the Marlow Hotel said that person visited their venue on Saturday and still hasn't heard anything from DHHS. It's now Tuesday. Do you think that's acceptable?
Well, again, we're happy to come back to you on exactly what has occurred, but there are literally thousands and thousands of contacts that are being made every single day. A person may have visited a certain venue, but it may not have become known to us that the person did that or tested positive until some time after. I'm more than happy to come back to you with some further details. But again, all of this, of course, could be avoided if people who were waiting for a test result simply use common sense. Again, I'm not so much commenting on the specifics of this case. We need to know more about this case. But ultimately, travelling from one side of the state to the other while you're waiting for a test result, that's not ideal. That is not what we would like people to do. Again, not just this specific case, but in broad terms, if we all simply follow those rules and wait for the result, then we will do much more to prevent the spread of this virus, and that's ultimately what we all have to do.
It does seem to be a common theme though in Colac where they're even setting up their own contact tracing system because they're waiting too long for DHHS.
Well, there's been some reports, I think some comments on Twitter that are simply wrong. The abattoir, the meatworks, is closed down. Every single staff member's been told they're a close contact. So it's very easy to make some of those claims. I don't think that serves anyone's purposes. Ultimately, there are literally thousands and thousands of people, the biggest team ever, dealing with the biggest challenge we've ever faced. They're all doing their absolute best. But as I said yesterday, I think Bridget asked me a question yesterday and I made the point, not everyone answers the phone when they're rung. Not everyone provides the most accurate email address. Not everyone does every single thing perfectly. It's a big team and they're doing their level best. It is a variable, challenging thing. The other point too, not everyone's necessarily pleased to hear the news that they're going to have to isolate for 14 days. It's complex. There are all sorts of emotions, all sorts of challenges with this. But it's a big team. It needs to be big. It's bigger than it's ever been. It'll get bigger still because the challenge is bigger than it's ever been. But everyone in that team and so many beyond that team are all doing their very best night and day. And all I can ask of them, all any of us can ask of them, is that they do their absolute best. This is not quite as simple as it seems. I'd ask you, I'd ask everyone just to think about how many people you might have come in contact with over the last 24 hours or 48 hours. It's not quite as simple as it sometimes looks.
Given that we are having a lot of problems getting in touch with people.
I don't accept that we are having, as you've described it, Rachel.
Well, there are numerous instances. There was a primary school yesterday where it was 22 days between kids being exposed and DHHS getting in touch with them. But given that, would you encourage people to try to do what they can to get in touch with people they might have had contact with and maybe help DHHS out?
Well, look, the first thing to help all of us out, not just a government department, but to help everyone in the state out, is if you get a positive test, you shouldn't wait until, because you get your positive result. It's not like literally as soon as you hang up the phone or as soon as you put the phone down from having got the text that says you have this virus, that literally moments later somebody from the health department is going to ring you. That's not how it works. There will always be time that is needed to get that information, to then make contact with you, conduct an interview that can take an hour or more, and then start the painstaking work of going through each and every one of the people you might have been in close contact with. The first thing, to help out, if you like, the first thing would be if you get notified that you are positive, then you shouldn't be leaving your home. You should do the right thing, which is to isolate. If you need support, there is support there for you. Whether that be a care package, whether that be the grant that I just spoke of, close contact's the same. No one can wait around until somebody from the department rings and says, you know, that positive test result you got yesterday or earlier today, that means you can't go out. People know, I think,
of course. Should
that
people in that
common sense is probably the best
guide.
guide.
They know they've been in contact with.
Again, I suppose there's no harm in doing that. There'd be no harm in doing that. But again, the first thing to do, I suppose, is to compile. The best thing is to stay at home, follow those rules as they apply to you, and then if you want to start the process of thinking who you've been in contact with, so that when the person rings, if it's a 10-minute interview instead of a 1-hour interview because you've spent a bit of time thinking about who you were with, then that'll be all to the good. It's a big and complex task, but just because someone sends out a tweet saying that a meatworks in Colac hasn't been contact traced, it's just wrong. It's absolutely wrong. Absolutely wrong.
You previously flagged that you were going to bring in private entities. Well, you considered bringing in private entities and getting
Yes.
something to contact tracing. Are they part of the bigger team?
There's a mix. I can come back to you with a breakdown. It's pretty fluid in that it changes pretty well every day. I think we'll be up to about 2,100 quite soon if we're not already at that number. That's a mix of a small number of ADF support, significant numbers of off-roster Ambulance Victoria staff. That's separate to the two-up shared crews, if you like, ADF and AMBOs. That's for a different purpose. But there are a number of Ambulance Victoria paramedics who, for one reason or another, can't be out on the road, so we're using them and their clinical skills. Some private sector involvement, but again, I'd stress there's been private sector partnerships around this right from the very start. A number of workforces that were stood down, we kind of grabbed those people and said, look, you come work for us because you've got the skills in terms of customer service and often dealing with very complex issues. As it stands right now, the exact composition of the extra team, I'm more than happy to come back to you.
Would you say that that's enough for what we need right now, or is that all we can get right now?
No, I think we've got additional contingencies. I think I've spoken a couple of times now about reaching out to the banks and trying to train up a number of people who won't necessarily be needed right now but may be needed in the future. There's obviously fatigue issues. It's a big team and you've got to balance the fact that they're being asked to do more and more every single day. So that's achieved two ways, I think, by growing the size of the team but also making sure that you've got people in reserve. That's the intention around some of those bank staff, but there'll be others that are possibly involved in that too. Again, if I had the figures to hand, I'd give them to you. I don't, but I'm more than happy to come back to you.
And is that team at capacity at the moment, or is that you feel comfortable that they can handle it?
Well,
at the moment?
it's not a matter of feeling comfortable. It's very, very challenging work, and it is the biggest team it's ever been. It'll need to get bigger again because the challenge is the biggest that it has ever been. I'm confident they're all doing their level best and we've got enough people there. But will we need more in the future? Next week, the week after? I think yes, which is why we're calling upon interstate support and we're getting it, very grateful for that. Private sector partnerships, other government agencies where for one reason or another they can't be deployed doing their normal work but have, for instance, those clinical skills and have got a really proven track record of dealing with complex and challenging environments. It's the biggest it's ever been. It'll need to get bigger again, and I'm confident that we've got the plan in place to do that.
A lot of cases are related to workplaces. Are you
Yes.
considering ramping up workplace compliance?
Well, that's part of announcements we made a couple of days ago. So WorkSafe and Victoria Police, particularly high-risk workplaces where there's a lot of movement of people, or at the same time, high-risk workplaces where maintaining that physical distance is really challenging, together with things like temperature, meatworks, boning rooms, those sort of settings are not just a challenge here in Victoria, they've been a challenge nationally, and they've been an enormous challenge in other parts of the world, with literally thousands and thousands of cases coming out of individual individual sites. It's not a matter of having a go at management or anything like that. We're working very closely with owners of those businesses, but just making doubly sure, triply sure that things are as they should be. That's the work that WorkSafe as well as Victoria Police are doing.
Just on buttons, DHHS website still says there is no enforcement with the use of masks, and you will not be fined if you don't wear one. Will that be changed by Thursday?
It'll be changed by midnight tomorrow night, because that's when the new rules come in place. If we were to tell people that they get fined right now, I'm sure I'd be getting a question about why we were issuing fines before the law had changed, before the rules had come into effect. There'll be a full, frequently asked questions, long form, lots and lots of detail to provide people with the clarity and certainty that they need. But I suppose the key point here is I just ask people to err on the side of caution, err on the side of not spreading the virus, do that little extra thing, wearing a mask when you're out for one of the 4 reasons. It's very, very important. Whether it be me coming to a press conference today wearing a mask, my Year 12 son going off to school this morning wearing a mask and wearing a mask throughout his classes. If Kath was to go out today, she'd be wearing a mask. These are simple things. They're unusual. They're not the normal way that we would live our lives, but nothing about this global pandemic is normal. It's very challenging, and it's a small but really significant contribution that each of us can make.
There was results this morning that for up to 5 hospitals, I think, were on divert last night at some point. Is that to do with short staffing because so many hospital workers are now isolating, waiting for tests, that sort of thing? Is this starting to have a real impact on hospital systems?
I'm not sure about that, Laurel, but I can come back to you on that. The issue, from time to time, you'll have hospitals that are particularly busy. Having just said nothing's normal, I will make the point, though, that winter is always a very challenging time for our health system, whether it be through flu or whatever, a whole range of other circumstances that we have to confront. We've got a number of health staff that are furloughed because they might be a close contact. We've got a number of health staff that have tested positive. There's a mixture of both people that have contracted it at work, we think, but also others who have got the virus from non-hospital settings, and that's the nature of having transmission in the Victorian community. I think we are confident that we've got plans to backfill those staff. We've got plans in place to have additional, particularly specialist staff, those really acute care staff. I'm happy to come back to you on the individual circumstances of those hospitals, but I'm certainly not briefed that we've seen a really big shift in that. It's a challenge, there's no question, whenever you've got key staff, whether it be members of Victoria Police, members of Ambulance Victoria, hospital staff, the list goes on and on. I think at the same time, though, one of the things coming out of these last few months, we've all had to rethink what it is that we might regard as essential, there are challenges in terms of roster lines at supermarkets. There are challenges in terms of filling rosters in hospitals. There's challenges everywhere, but they're certainly no more acute today than they were yesterday or the day before.
The IBAC commissioner has come out this morning. He said he doesn't have enough funding for his agency to do its work properly. Would you advocate for more money for the IBAC?
Well, there's been some changes made both to expand in historic terms the powers, the reach of IBAC. There's been some other changes in terms of moving this to become part of the parliamentary budget as opposed to something that sits in the general accounts of the state. I know there's been a number of underspends in recent years, so funding has gone up and it hasn't necessarily all been spent in a single year. It's been rolled over and carried forward. That's not always the case. The Treasurer here, he'd indicate that no agency should assume that if they underspend in one year, they'd necessarily get a rollover the following year, but they have received that each time that that's been the case. We'll always work with all of those integrity agencies to see if we can provide them with any more support. They play a really important role. We want them to be able to do that.
Another 12 schools closed yesterday. Are you reconsidering having these students on Sunday?
No, we've seen schools close. It's been a routine feature. When you get cases, you've got to go and do the deep clean, you've got to send people home. That's not to downplay the significance of that, but it has been a routine feature of this global pandemic, not just here but in other states. We're comfortable that the arrangements, particularly as we move to masks being mandatory from midnight tomorrow night, there is a low risk, but the reward is very significant, particularly getting our Year 11 and 12 students through and having one VCE, one VCAL, rather than having two fundamentally different settings between regional Victoria and Metro Melbourne. The other point too is that with stay-at-home orders, unless you've got that supervision and the ability for parents who can't stay at home to send their kids into a supervised environment at school, that's when we'll, further to Laurel's point, that's when we'll really see some significant impacts on the number of roster lines we can fulfil, the number of shifts that can be worked in all sorts of industries, not least of which health, hospitals and emergency services.
What's your message to Victorians that continue to cross over to the South Australian border?
Well, the South Australian border, there are rules in place, and I think there are very significant penalties if you were to breach those rules. That's a matter for the South Australian government, but I'd be confident in saying they will penalise you heavily.
And in relation to the 3 deaths overnight, any idea of how they actually contracted the virus? I think you mentioned there that they may have from a nursing home.
Sure. I think that it's probably best if we wait till there's further conversations with individual families and we might be able to provide you with some further details at the 1:30 Chief Health Officer media release.
Professor Sutton, just on the cases that are happening in regional areas, have you made any recommendations, or would you like to see certain regions that are not locked down go to the same restrictions as Victoria?
No, in terms of regional areas of Victoria, there was always an expectation that because of essential work and essential reasons to travel, that there would be some seeding of cases into those regional locations. We have to watch it closely. We have to understand whether community transmission becomes established anywhere. But individual cases can be followed up, their contacts can be traced. They're being prioritised amongst all of the new cases and contacts that we get every day. And there is every expectation that we can manage them, but we do have to see whether there are cases that emerge where we don't know where they've acquired it, and if there's increasing evidence of community transmission that's not coming under control, then I think that's when there's a consideration about any further restrictions. But the same messages apply, even though the restrictions are not at quite the same level, that you can have visitors to your home, that you can meet in groups greater than is the case for Melbourne and Metro Shire. We would absolutely recommend masks for people still as a recommendation. We would absolutely say if you're unwell, stay home, get tested. They're the things that will protect people across Victoria.
The numbers last week, you said the next 48 hours are pretty low in terms of weeks, now almost a week later. Would you have hoped, would you expect that by now you wouldn't be talking about 374 new cases?
Certainly I always hope for a decrease in cases, but I think I've flagged already this is a more challenging wave. I think it's a slower turnaround, and that's why the consideration of masks is one of those additional considerations, because I think we have to get on top of those ongoing areas of transmission that do relate to casual workplaces, other workplaces, and potentially other settings where people are going out for essential reasons. I'd love to see it turn. It's still not at the 14-day mark. There is an expectation that that's when you can see a change. I'm keeping my fingers crossed with everyone else.
How much of it, when you say community transmission, you say flattening, is it curbing, how do you describe it?
Look, I think the fluctuations on a day-to-day basis are difficult to make a call on, but there has been a flattening in the last week. We're not seeing that exponential increase day by day that we saw earlier. I think that's encouraging.
Right. Oxygen monitors have emerged as something that's being used for people who've been diagnosed. Can you tell us a little bit about how that treatment is chosen for each individual patient?
Sure. I'm not a clinician anymore. I was an emergency department doctor for many years, but individuals are basically affected through infection across multiple organs, but especially the lungs. It seems to be a feature that blood vessels are really affected, and it can mean that some people don't actually experience the shortness of breath while their oxygen levels are dropping significantly. So oxygen monitoring, a saturation monitor for individuals, can be a really good objective way to see what their requirements are if they need oxygen. Obviously, there are a number of people who can be looked after at home with relatively mild disease, but it is important that if someone's getting lower and lower oxygen levels, that there's an early intervention, whether it's with dexamethasone or remdesivir or one of the other therapeutic agents. That's really important to monitor. And I think the daily check-in by a clinician or indeed by our case and contact staff to see whether people are feeling worse, to see whether they are managing or not managing at home is a really important check-in, because if people need a step up in their care, it is really important. Oxygen is one of those very simple interventions, but it will be up to the individual clinicians as to whether they choose something else to manage those illnesses.
Have we had anyone actually die in their house without being taken to hospital?
I'm not sure. I'm not sure the circumstances. Most people have died in hospital. Obviously, I'd encourage everyone who feels too unwell to manage at home, or if they're unsure, to do the right thing and the precautionary thing, and go to hospital, or to call nurse on call, or obviously in an emergency to call 000.
What's your impression of the vaccine trial results coming out of London overnight?
I think it's all very encouraging. They are early stages with vaccine developments. What it's really going through with the vaccine phase at the moment is to show that it produces an antibody response and an immune response that we would expect to be protective. The next phase is to test on tens of thousands of people in a real world setting where there's lots of transmission going on, to see how effective that vaccine might be in real circumstances with one dose or with two doses weeks apart, to see whether it's 50% effective, 90% effective or better. There is a question about whether it'll be a long-term protective effect, which they'll need to monitor. There is a question about whether it just makes you have milder symptoms or milder illness, or whether it genuinely protects you from transmission. We're all hoping for what we'd call a sterilising vaccine, one that absolutely protects you from getting infected in the first place, because that's what will stop transmission across the board.
Just on aged care, I think the Premier confirmed earlier that one of the cases who died overnight was in the aged care setting. Are there any more, or just one?
There were two who are linked to aged care outbreaks.
How comfortable are you with what's happening in aged care? We're hearing from staff that they're still not getting the proper PPE that they were promised. Are you comfortable, or are you concerned that things aren't being dealt with as they should be in aged care homes?
I think things are being dealt with appropriately in aged care. It's super challenging to manage outbreaks in aged care. The population is the most vulnerable population. They're at much, much greater risk of severe illness. PPE has rolled out completely. We have made a very clear direction that staff need to wear it in all circumstances, both for interactions with residents but also for each other. There's a shared responsibility between the Commonwealth in terms of the workforce and the compliance and quality assurance, but also the outbreak management, and we're sending squads out for every new outbreak on a daily basis and getting across to see if there are any issues that need to be worked through. But it's intrinsically difficult in those settings because of the absolute vulnerability of the population and the need to provide care, face to face.
So it's your understanding that PPE has been rolled out to every private nursing home?
Again, it's a shared responsibility. The Commonwealth would have to answer to what they've done in that space, but I haven't heard reports of a failure of PPE to be in place there.
Are you happy with the contract
We-
numbers at this point, or would you, do we always need more?
No, we're scaling up as we need to scale up for contact tracing. We're getting through those, 200-300 interviews that we need to do every day, and the hundreds and hundreds of close contacts that arise from those interviews. The processes can be complex. There are people whose phone numbers are transcribed incorrectly. There are people whose phone numbers have not been recorded at all. They're people who aren't going to get a call from DHHS because we haven't been able to contact them. There are also circumstances where the individual will get their SMS text message to say that they're a case, but DHHS hasn't yet received that notification from the laboratory or from the medical practitioner. So that's the only point at which we can do our follow-up, when we're notified of a case. So an individual might hear that a day or 2 days in advance of DHHS. As Rachel's pointed out, it's absolutely appropriate for individuals who know they're positive to absolutely isolate at home, including from their close contacts at home who might be negative, who might have ongoing protection if you can isolate yourself, including within your household.
Would you like to see people off their own bat contacting people they know they've been in contact with?
As the Premier said, it's absolutely worthwhile to list all of the people who you think you've been a close contact of. Obviously, it's your household contacts, anyone you've been in a room with for more than 2 hours, anyone with more than 15 minutes face-to-face interaction. If people can go through the list of names and contact numbers, that makes the job of recording it for our interviewers much, much easier. So I'd absolutely encourage that.
And if they feel comfortable, would you encourage them to contact those people?
Yeah, they have to feel comfortable to contact those individuals. They have to be able to explain what the requirements are, but the initial message to your close contacts would be, you're a close contact, you might develop illness, you need to quarantine. So you're well, but you need to isolate yourself from other people until you have further instruction.
Minister, do you have you been briefed on the hospital issue? Can you provide more information?
Sorry.
In terms of the bypass?
Oh, bypass, yes. Yes, so the reasons why there might be an ambulance Victoria-initiated bypass might be many. I understand that one health service was undertaking an IT upgrade last night. There are differing circumstances. I believe there may have been 3 health services impacted by differing situations. Obviously, we've had quite a large number of staff who have been furloughed at Northern Hospital as a result of healthcare workers being exposed there. The good news is that I understand that about 100 of them are returning or coming out of furlough today and able to return to work. So at the present time there are no health services on bypass, but they have been facing some challenges as a result of staff either needing to be furloughed as a result of being a close contact. Demand, of course, does vary, as the Premier explained before, from time to time, and there might be other particular circumstances relevant to them. What I could say further to that is that, we are working very hard to support our health services in a challenging time. We've got about 16,000 people who might be either retired clinicians or medical students or nursing students and others who have registered their interest to assist us. Some of those tasks have involved backfilling of positions where we've had health services experiencing particular issues as a result of a significant number of staff needing to be quarantined, and our health services do take a very, very conservative approach to these infection control issues and would furlough, I guess, a larger number of people than might happen in any other workplace. Or they might be assisting us in contact tracing. As the Premier explained, we've got a large number of paramedics unable to work on the road. They might be pregnant, they might have other reasons why they're not able to be performing a role on the job, and so they're assisting us with contact tracing. We've got many of those people who registered also assisting us with testing Victorians all across Victoria. So the point that I would make is that we are very, very grateful for all the work that our dedicated healthcare workers are undertaking at this present time. They are turning up to work each and every day to support each of us, and the least that we could do is to show our gratitude and our support by staying at home.
Just to confirm, it was the Northern and which of the other 2 hospitals?
I believe it was the Austin and Monash had an IT upgrade issue, so unrelated to any demand issues.
So there were 2 hospitals that were on bypass because of staff shortages?
It was a combination of issues, but the significant number of staff being furloughed at the Northern has been challenging for them. I think they've been managing very well in challenging circumstances, and I know other health services in that region have been assisting them with that work as well. Look, we're very mindful of the particular needs of our health services. This is why they've received nearly $2 billion of investment from our government. If our health services need more support, they will have it. If Brett and his public health team need more support for contact tracing, they will have it. You know, we have been continuing to expand that contact tracing team since the start of the year. It's grown very significantly from where it was at the start of the year. As the Premier explained, we've got new people who've come on board recently, including from Health Direct, which is associated with Medibank. You know, these are trained nurses, they're clinical staff, and have been able to now assist us with contact tracing work. So there's a huge team of people now, and that's growing all the time, working round the clock 24/7 to do that important contact tracing work. But, you know, as has been already said, you know, people should do the right thing and stay home as soon as they go for a test, as soon as they have any symptoms. Even before you go and get your test, you know, you should not be going out and about. Our turnaround times for pathology results is actually very good at the moment. It's averaging between 1 and 2 days. And until people get that result, they should stay home. Once they get the result, if they're positive, of course, they are legally required to stay home. And of course they will receive further advice. The result that they get, of course, comes from a pathology lab. It's not from the department, and it does take some time between the pathology lab notifying the department then being able to make contact with that particular person. So it's really important that everyone does that common sense thing once they get a test result, is to stay home and not to go out, and also to take steps to protect other household members who might be negative at that point in time, because what we have seen, of course, is family members cross-infecting other family members, and there are very sensible precautions people can take even within their home to limit exposure to others, and that has also included wearing a mask in their home. If you're positive and your other household members are negative, then you should be taking steps not to infect your other household members, and the DHHS team can provide advice to people about how they can do that. If there's anything further?
I might just
Yep.
finish by saying this is one day at a time, and I'd ask every single Victorian to continue to follow the rules. I'm very grateful, very, very grateful to the vast majority of Victorians who are changing the way they behave every day. Just the sheer number of people that are already wearing masks across Melbourne when they're not actually required to until midnight tomorrow night. Thank you so much for that. The rules are pretty simple. You go out when you need to, only for the things you absolutely need to. Those 4 reasons are pretty well understood. To Rachel's point earlier on, the best thing, if you get the text message from the laboratory that says you're positive, spend a bit of time thinking about who you've been in contact with over recent days. That's a simple but a powerful thing, and it means that the work of our dedicated contact tracers, of which there are a couple of thousand now, there may need to be more, and if there is, there will be. That's just a simple thing, but you've got to stay at home. If you've got a positive diagnosis, you've got to stay at home. What's more, if you, any Victorian with even the mildest of symptoms, please come forward and get tested. If we all follow these simple steps, if we all make these sacrifices, large and small, then we will get to the other side of this second wave. We'll get there together, and we'll be able to begin the process of opening up again. To those who are doing the right thing, thank you so much. To those who aren't, well, it's the wrong thing to do. It's not a very smart thing to do either, because Victoria Police are out there, and recent enforcement data shows you, or should show you, that if you are doing the wrong thing, you'll be caught, and the fines are significant. They're there for a reason, to protect everybody. Is there any other issues?
What is the enforcement data? What have you seen in regards to that?
Oh, I've seen Victoria Police doing their job, and I've seen it pretty clear. If you think that you can just ignore the rules and make really selfish choices, your odds are not good. You will get caught, and you will receive a fine. So it shouldn't have to come to that. And it shouldn't diminish either from just how proud and grateful we are of the vast majority of Victorians who are doing the right thing. But as we've seen, this is a wildly infectious virus, and it only takes a handful of people to do the wrong thing, and you can finish up spreading this. Many, many cases can come from even one person doing the wrong thing, and we've kind of discussed some of that today.
There we had Victoria's Premier Dan Andrews addressing the state with the very latest on the unfolding coronavirus situation. We'll have full coverage tonight in the local wrap-up at 6 o'clock, but for now, it's back to general programming.